Thank you to Sages for the opportunity to present our research. These are our disclosures. There are no industry disclosures that pertain to our model. The focus of this presentation is scope torque skills, which are needed to position and orient the scope so that it is possible to interact with polyps or other pathology that is encountered in the colon. There are additional teaching models in the Northwell program that cover other advanced skills listed on this slide. The Northwell program embraces a modular approach wherein some skills are taught in a very focused manner. This approach is believed to result in more rapid skill acquisition. The program also includes modules wherein complete ESD cases are done. The training system uses inanimate and ex vivo animal large bowel models only. Therefore, training is not dependent on clinical case volume. This allows for training schedule and timeline to be flexible. The relationship between the camera and the instrument channel in all colonoscopes is as such that the tools are passed through the instrument channel, exit the colonoscope at the bottom right of the monitor image. These tools can best interact with polyps if the lesions are also located at the bottom of the image. Torque is how the polyp's position relative to the endoscopic tool is changed. If the pathology is located down on the monitor, then you can see both the polyp and the tool at the same time. Further, when both are down, the distal scope shaft is parallel with the polyp-bearing side of the bowel wall, which means the minimal tip deflection should be necessary when using a snare or a knife. Further, when the pathology is in the down position, the working channel is closest to the side of the bowel wall with the polyp. The consequence of this relationship is that when using a knife, minimal tip deflection is required. Although not recommended, at times it is possible to snare a pedunculated polyp in the up position on the monitor. To do so, however, the distal scope shaft must be deflected sharply upward in order for the snare to engage the polyp stalk. This has the unintended effect of shifting the scope's view away from the polyp. To summarize, the ideal position for the pathology is on the bottom of the monitor image, since that is the working zone for the through the channel instruments with an endoscope. As mentioned, applying torque to the scope shaft is how you change the position of the polyp relative to the colonoscope image. The goal is to move the polyp to the down position. Changing the position of the polyp, by far and away, the most effective way to change the polyp's position is to apply torque to the scope shaft near the anus with the right hand. In addition, torque position can be changed a bit if the left lower arm, which is holding the scope handle, is rotated medially or laterally. Lastly, the patient's position is changed. It will impact the polyp's position on the monitor. It is a challenge to adjust the knife or snare's position when torque is required to position the polyp. There are 3 ways to stabilize the torque position while moving the tool in or out. First, if the left hand is kept close to the right at the height of the anus and the thumb and the first finger of the right hand can move the knife or the snare. Second, the endoscopist can use a thigh to stabilize mild torque by trapping the scope between the thigh and the table. The third option is to have an assistant hold the scope at the anus while maintaining torque or adjust the instrument's position. In our model, a hollow plastic tube with 20 randomly placed small holes serve as the colon. Small pieces of cotton are placed in each hole and held in place by a plastic oversleeve. A round slitted sponge serves as the anus. A sclerotherapy catheter with a felt marker tip is inserted at the end and serves as the pen. Dye-colored saline is the ink. This slide is for reference and shows the dimensions of the plastic tube. Here we see small pieces of cotton being placed over each of the tube's holes. Next, numerous 2 to 3 inch long plastic oversleeves are placed along the tube to stabilize and compress the cotton plugs. After loading the tube, it is mounted onto a pegboard held in place by vice grips. Round sponges, one of which is slitted, are placed on each end, as mentioned before. In the scope training session, the trainee stands at the end of the model and views a monitor placed at the head of the table. The scope is inserted to the first hole and torqued so that the pen and the hole are down. Next, the sclerotherapy catheter is extended and the cotton target is touched with the pen. The scope is then withdrawn, and then the next target at a different circumferential point is found, and the torque is adjusted appropriately. The target is then touched, and then the process repeated. The exercise can be done either proximal to distal or in reverse order. Initial sessions are done with the pen left extended from the tip between targets. However, once mastered, the pen is withdrawn and re-extended between targets. The time required to touch all 20 targets is noted, as is the number of targets touched. The pen management method and the number of times the pen touches the tube around the hole instead of the cotton plug will also be recorded. Hand position will also be tracked. Trainees can do up to 4 runs per visit. A total of 8 trainees are receiving, well, actually it's up to 20 now. A total of 20 trainees are receiving the training presently, and the data is still being analyzed. Currently, we are recommending that at least 8 sessions be done per trainee. In summary, to interact with the pathology, scope torque skills are needed. Endoscopic instruments exiting colonoscopes always appear at the bottom right of the monitor view. Polyps need to be positioned down and to the right so that instruments can touch them. Twisting the scope shaft with the right hand is the main way to impart torque. Once the torque position is set, it is a challenge to extend or retract instruments. This model and others like it may have value in teaching torque and other skills. The Department of Surgery at Northwell Health has developed a 6-module teaching program solely based on inanimate and ex vivo animal models, the goal of which is to teach basic and advanced skills via instructions and repetition. Although the stated goal of the program is the ability to perform ESD, it is our hypothesis that completion of this program will notably and forever increase a trainee's skill set to ability to perform EMR as well as standard endoscopic procedures. Thank you.